Good Wednesday morning, folks. I'm Keitha Nelson here with Good Morning Jacksonville, talking with you all about the coronavirus, also known as COVID-19. This is something that's on so many of our minds, just like myself. Every morning you wake up, you see a new case popping up on your phone with these alerts. We now have the first confirmed case of the coronavirus here on the First Coast. It's a 68-year-old man out in Nassau County. So a lot of you, we know, have a lot of questions. So throughout the next 30 minutes, we'll be answering your questions live right here on our First Coast News and Good Morning Jacksonville Facebook pages. Any questions or concerns you may have, you can write them in the comments section. And we have an expert here to answer your question. Now, this is Chad Nielsen. Welcome in, Chad. He is the Director of Infection Prevention at UF Health Jacksonville. Chad, I want to dive right into this because so many want to know, how are we preparing for the coronavirus should it hit us right here in Duval County? We see how close it is now in Nassau County.
Yeah, and I think that's a topic on a lot of people's minds right now. What are people doing? What should we be doing? And what are the hospitals doing? So I can speak from UF Health Jacksonville's standpoint and for many of the hospitals in the area that we've been preparing for this for a long time. The Ebola outbreak in 2014 sort of kicked all the hospitals into high gear in getting their preparedness and things like that ready for these kind of outbreaks. And so we have hospital plans for this. We have isolation rooms for this, personal protective equipment. And so the hospitals are ready to see these patients if they do start showing up or coming in. And so for the public, we want to make sure people aren't panicking, that they're continuing to do things to stay healthy, washing their hands appropriately, using cough etiquette, social distancing. So when they're sick, not being around a lot of people, don't go to work sick, don't send your kids to school or preschool sick. Those kind of things are going to go a long way in ensuring everybody stays healthy.
You know, we talk about the things you say: wash your hands, use hand sanitizer. They sound so basic, but it's really what we've been hearing again and again from officials like yourself, doctors as
Sure.
well, telling you that's what needs to be done. And let's talk about this specific case in Nassau County, a
Sure.
68-year-old man. He is within that pocket, that population that we feel are most vulnerable at this point. So there is definitely a heightened concern.
Yes, definitely. So, what all the research is pointing to at this point is that, those above about 60 years old who are immunocompromised, who have comorbidities, pregnant, are most at risk to get this infection, as well as suffer more severe consequences of it. And as that age group sort of shifts down, you see less and less cases. But it's an early sample number, so we don't know the full extent of who it affects. But at least right now, we know it's older individuals.
That's who we're most concerned about. Now, again, if you're just now joining us, we're talking with Chad Nielsen, the Director of Infection Prevention at UF Health Jacksonville. He's our expert for the day, talking with us about the coronavirus. We're encouraging you to ask your questions. Just write them right down there in the comments section. Now, we have a question in from Jason Becky Fricks asking, how bad is the virus? Flu-like, common cold-like? Can you break that down for us, Chad?
Yeah, symptoms right now, from what we know, are showing to be rather flu-like. So, fever, cough, respiratory output. So, we're not seeing mild sequelae where, people are walking around going to work with it, but we are seeing something a little bit more like flu right now.
You know, a lot of folks feel as if they're getting mixed messages out there from our elected officials about what they should do in case this happens. But let's talk about quarantine. How do you
Sure.
know if you need to be quarantined?
Yeah, right now I think everybody should be following the CDC's recommendations. So they have lots of information on, have you traveled to this country or this country? Did you just get off a cruise ship? They lay out all of that information of who should be quarantining themselves. And really, it's folks who are coming back from areas with known outbreaks or areas where, although you might not be directly exposed to somebody, they could have been in the area. So Italy, China, Japan, things like that. Those are the people who, need to be quarantining themselves in what they're calling self-isolation for 14 days.
Right. We just got something in from Melissa Nielsen Miller. She's asking, would the test show if you had it in the recent past or only if currently infected? That's a pretty good question there.
Yeah, that's a good question. Right now, the test is looking for recent acquisitions. So, right, the way a test is, your body forms an immune response, and the test is looking for bits of that virus that might be floating in your sputum or your saliva. So, it's looking right now for more active cases, but to be determined how that looks moving forward in the future and whether there's going to be new tests or not.
Yeah. And we have another question. I'm sure you could just give a suggestion to this person. Nicole is asking people who have booked or paid for their holiday vacation, what should we do? And we know vacation could span the entire summer. We don't know what'll happen
Yeah.
in the future, but what's your suggestion?
Yeah, so I think that's a good question. It's something I get asked a lot, even amongst my own staff here. What should we do? I think certainly there are some advisory countries that you should probably avoid right now. The Japan, South Korea, China's, things like that, that the CDC is recommending against travel to. But even cruise ships, they're warning certain individuals who might have certain health conditions should avoid cruising right now. And so I think it's best to consult the CDC and listen to your state and local officials on, good travel advice and tips. But there are things you can do to protect yourself. Again, hand sanitizer, hand washing, and not being around sick people.
This is something that will be really good to clarify. I don't even know if you can. Is this just a seasonal virus? Do we even know at this point?
Yeah, we don't know at this point, honestly. I think a lot of the panic stems from the fact that this is new. We haven't
Hmm.
seen anything like this before. And so as time goes on, we're going to see more of this. We do know that, back in 2009 with the swine flu that came out, it ended up being more seasonal. And we still see cases of that during flu season to this day. But right now with this novel COVID-19, we just don't know yet.
Ginger Bell asking, I have to go to a lab today for blood work. What precautions should I take? She's not alone. What should she be doing?
Yeah, so I think it's always smart to understand, what your role is as well as what the expected role of that person is. So good hand hygiene for the staff when they're touching you or when they're interacting with you. Do they have hand sanitizer? Are they giving you opportunities to protect yourself? That goes a long way in sort of assessing your risk when you go in for that sort of thing. But I think just ensuring that you're holding the staff accountable to be washing their hands, wearing gloves, and those sort of things.
Yeah, so we
Yeah,
mentioned
that's a good
panic. You and
question.
I were speaking off camera. We don't want
Yeah.
folks to get panic, and it's important for people to be precautious, but don't go overboard. This lady's
Right.
asking, how safe are nail salons?
Yeah, so nail salons are actually regulated by health authorities. So anybody who wants to open a nail salon has to go through very strict licensing with either the health department or the Better Business Bureau. And so they meet very strict regulations in terms of cleaning their stuff and what they can and can't do. So at this point, nail salons are not showing to be something of an increased risk for COVID-19.
And we also know that COVID-19 is serious for folks with respiratory problems. So that brings
Yes.
me to this next question from Tracy asking, how bad is this virus for someone with asthma?
Yeah, people with asthma, common and frequent smokers, and people with underlying respiratory conditions, they will have more risk for a more severe outcome if they were to get it.
Mm.
There's not evidence right now to show that necessarily they're more susceptible, but as is with the flu virus, the cold virus, anything that is seasonal, those with respiratory issues pre-existing are going to have a worse course of illness.
Now, Chad, because this virus is new, I know a lot of these questions might be a little difficult to answer, but Leslie's asking, can someone be a carrier of the virus even if they don't get sick? Do we even know?
Yeah, so there is this thought that there could be shedding and a carrier of a virus before they show symptoms. Right now, it looks like the average time from exposure to symptoms is looking at about 5 days and as long as 13 to 14. So people do typically shed while they're symptomatic, but it's a little bit undefined on how much they're shedding right now. It's more research. But certainly, once they become symptomatic, they're definitely going to be shedding that virus.
We keep on saying it again and again, wash your hands, use hand
Yep.
sanitizer. But Vandan is asking, how contagious is this virus? Can you get it from going to the grocery store? Something so simple. Every one of us do this every day. Can you get it
Yeah.
from the grocery store?
Yeah, I mean, I think if you measure your risk according to flu, right? So kids get flu virus or the cold just from going to school. They can technically pick it up from a shopping cart. This is very similar to how flu and cold viruses spread. So theoretically, the answer is yes. You could be standing at line at the bank and somebody can cough
Wow.
on you and you could be exposed. That being the case, we're not seeing community acquisition of COVID-19 right now. We still are in respiratory viral season, and so people still need to be thinking about cold and flu.
That brings me to something I do want to mention. So, again, if you're just now joining us, perhaps just now waking up and hearing the news, we do have our first confirmed case of the coronavirus on the First Coast. It's a 68-year-old man out in Nassau County, waiting to learn more about his particular situation. But we do know this is travel related. We just heard Chad
Yes.
Nielsen, Director of Infection Prevention at UF Health, mention this travel related versus community associated. Give us the explanation about the difference of the two.
Yeah, travel related literally means that somebody traveled to a region that's having an outbreak and picked it up from there and then traveled back to the state of Florida. Community related means that the virus is spreading amongst the community among people who have not traveled to known outbreak areas. So, community acquisition is what we're talking when you start seeing it spread through Washington and the nursing home. It got introduced to that area and then it began spreading amongst the community there.
So we're answering your questions right now live on Facebook on our First Coast News as well as Good Morning Jacksonville Facebook pages. Any questions you may have about the coronavirus, Chad Nielsen is here to answer those questions for you. I want to get to Mary's question that is very concerning because, look, we don't want this to affect our everyday lives, but unfortunately it is. So Mary's asking, how do we know what the spread of this will look like? I'm having a wedding with 100 guests. 4/4 when she's having it. Should we cancel? This is happening
Yeah,
April 4th.
Yeah, right now I don't think people should be canceling everything, right? So the Players Tournament is going on right now
Yeah.
as we speak, and that's expecting to get 200,000 people. There's events everywhere going on right now, 5Ks and weddings and things, and there's no reason right now to start canceling all of those. Certainly, if people are sick and they're coughing and sneezing, just in general, they shouldn't be at those events anyway. And I think that we need to just keep that in perspective until we start seeing more community acquisition cases, and we're seeing 2, 3, 5, 10, 20 cases in Jacksonville. You shouldn't have any effect to your events right now.
Okay, so that's good to know there. Some of these questions may seem a little repetitive, but it's good to clarify because so
Sure.
many of us have the same type of question. So is this airborne? Samara's asking.
Yeah. So, short answer, yes. That's why they're using the N95 masks and things like that to protect people, is because this virus, just like flu, just like cold, it's spread through respiratory secretions and droplets. So when people sneeze, it can be transmitted that way.
Yeah. Okay, folks. So we're with you for 30 minutes. About 15 more minutes to go. At 9:30, we're cutting this off. So if you have any questions about the
Sure.
coronavirus, Chad Nielsen, Director of Infection Prevention at UF Health Jacksonville, is here to answer your questions. He just went over the precautions for our local hospital, saying that they are prepared should we have any more cases in our area about the coronavirus. So Cheeky's asking, are children, young people with asthma at greater risk of contracting it? That's a really good question there. A lot of us, our parents, are concerned about this.
Sure, understandably, and I have a soon-to-be 3-year-old myself. So actually, the current literature is showing that children, for some reason, are not being infected at a higher rate than adults, which experts are really struggling to understand why children seem to be more immune from this sort of virus. However, those with underlying respiratory symptoms definitely are at more risk for any kind of respiratory virus and need to take precautions.
Now, once you actually get the virus, you get over it, can you get it again?
Yeah, theoretically, yes. There's at least one documented case in China where an individual was tested positive, tested negative, and then tested positive again. So, just like the flu, the actual virus itself can, mutate and change from year to year. And so, theoretically, yes, but we haven't seen that in the research yet.
Um, I'm going to ask you, Chad, to put things in perspective for us, because something we've always been pushing here at First Coast News is we're giving you the facts, not fair. We don't want to scare
Sure.
people. We have someone on here who said they are scared at this point. So put this in perspective, because you were in the health system during the Ebola outbreak as well as
Sure.
SARS. Put this in perspective for us, all of this.
Yeah, so I mean, when we talk about SARS and Ebola and MERS-CoV and these other sort of pandemic type events, we know that they had much higher fatality rates and they were much more untreatable in terms of the virus. Right now, we're talking a severe respiratory virus, but one that is mostly affecting older individuals who have immunocompromised systems. So the average person like you or me who don't have these underlying health conditions, we might get it, but it's going to be something where the symptoms can be treated and it's not going to cause a huge risk to your overall health long term. And so I think we have to keep it in perspective. There's large teams of people working in the background, whether at hospitals or health departments, ensuring that we're doing all the things as much as possible to keep the public safe.
I was in New York for the weekend and I was watching the local news there, and there was a couple that had the virus.
Sure.
the man tested positive, and he said again and again he called the doctor. He wanted to get tested, but no answers. No one gave him anything. And as we know, it spread. Now, Tara's asking, where do people get tested? That's a very important question. In our area, where do they go if they feel they have symptoms? What do they do?
Yeah, so if people feel sick, number one, they should try and call their doctors, right? Call your providers, your healthcare providers that you have contact with. The thing is right now, because there's not widespread community acquisition, not everybody who wants to get tested needs to be tested. Medically speaking, we're going to rule out things like the flu, cold virus, other more common things before we increase that level of testing to COVID-19. And so right now, most doctors' office clinics are still gearing up to be able to test for it. But based on the state of Florida guidelines that come from the CDC, not everybody who wants a test necessarily should get one based on exposure status.
All right, let's talk about mutation. This is something that I'm
Yeah,
assuming you can only comment on going back in the past, what you've seen happen in the past. How
sure.
likely is it that this virus may mutate or become even harder to treat in the short term? And this is coming from Antoine Harris.
Yeah, I don't think anything short term is going to affect anything, right? So we get a new flu vaccine every year because the flu virus, what we call genetically, drifts year to year, so it mutates very slightly, and that's why we always have to have a new flu vaccine, and we can't just get one shot and move on. So a lot of viruses do this genetic drifting that slightly changes its DNA to how it looks like, and then we have to form a new vaccine or something. But that takes time. That takes years. It could take months. It's not something that's going to affect the next 3 to 4 months.
Chad, I know we're hitting you with a lot of questions, but they keep on
Okay.
pouring in. We're going to get to as many
Sure.
as we possibly can. If you
Absolutely.
travel, can you be tested for corona as soon as you return?
So short answer is no. Only folks who are traveling to the level 2 and 3 advisory countries by CDC or are even at an exposure level to get tested. So recent travel to China, Japan, South Korea, Iran, Italy, those are people who, if you become symptomatic, you will meet person under investigation status and you will get tested.
Okay.
But rest assured, if you're going to Missouri or New York or anywhere stateside, with the exception of maybe Seattle, Washington, you're not going to meet testing criteria just because you traveled.
Okay. We have a question coming in from Imani. Why is everybody treating the coronavirus like the Black Plague? They're nervous.
Yeah, people are nervous. We haven't seen this before, and so public health experts like me, we've been watching this. The ability for something like this to happen has been increasing over the years because of rapid globalization. You can hop on an airplane in New York and be in China in less than 18 hours. So this is sort of the exact kind of thing that public health experts have been worried about. Now, luckily, this doesn't have a fatality rate like SARS or like MERS-CoV or even Ebola. And so, over time, as more cases appear and we sort of figure out what the epidemiology is, I think a lot of the panic will start to release.
You mentioned the numbers. I'm going to go over that briefly. So we know right now more than 1,000 confirmed cases within the U.S., almost 30 deaths reported at this point. And so 70%, this is some promising news, I suppose. 70% of those affected in China have recovered. So brings us some hope, I suppose.
Yeah, absolutely. The ones who are having worser outcomes and are dying are people who are already very sick or have lower immune systems or other comorbidities. So the vast majority of people who are getting COVID-19 are recovering for it without any long-term sequelae.
Again, a bit of a scare right now, closer to home, because we know we have our first confirmed case of the coronavirus out in Nassau County, a 68-year-old man. He's elderly, the population that is most vulnerable, that we're most
Sure.
concerned about in terms of the coronavirus. We're just going to have to hope for the best. And we know that late last night, the Florida Department of Health, they announced that 8 new positive cases, including that first confirmed one here along the first coast. So definitely a lot of concerns for a lot of us. I'm going to keep on getting to these questions, as many as we possibly can.
Sure.
Leanza is asking, I work for Publix in the aprons department where we cook and handle samples. As of last week, that program has been shut down until further notice. Will grocery markets start closing their doors? Now that will cause a panic.
Yeah, we're not hearing that there's anything going on with the supermarkets, at least here in Florida or even in Jacksonville, where they're going to close down because that's when you're going to see real levels of panic. that are warranted. I mean, people have to be able to get basic goods, they have to get their medications, things like that. I think that the CDC has urged people who are on life-saving medications to go ahead and stock up on those, just for supply purposes, to ensure that that kind of thing happens. But there's a lot of things that employers are doing. Target has recently announced, they're stepping up how they're cleaning their stores. All the airlines are doing this. A lot of the corporations are trying to limit their ability to spread this kind of a thing, and so that's one part of it. But again, basic hand washing and hand hygiene, things like that, are gonna keep you safe even at the grocery store.
You mentioned cleaning. Chad
Yep.
Nielsen, he's director of infection prevention at UF Health Jacksonville. So we have to ask you, what are our hospitals doing in lieu of all of this?
Yeah, so we've been looking at our supplies for several weeks now, ensuring that we have enough supplies to take care of our healthcare workers. We are beefing up, how we clean areas of our hospital that are high traffic for the public, and then we've also adjusted how we intake patients in terms of, have you traveled to certain countries and you have a cough and a fever. We're doing all these things as even more than normal, just to ensure that we're handling the public's concerns and allaying any fears.
Chad, have you mentioned Clorox wipes or Lysol? Do you go over that at all? Are those going to be helpful?
Yeah, so EPA has just released a list that most commonly, off the shelf disinfectants are good against this kind of a virus.
Okay.
Coronaviruses have actually been around for a long time, and we frequently see them every flu season. It's just, this is a new one, but it acts in many ways like the old ones in terms of its reaction to disinfection agents. So Clorox, Lysol, those types of things that say they're good for bacteria and viruses are going to be good for this as well.
Brooke Jackson. Brooke, I was just in your shoes. I'd be freaking out myself right now, but Chad is here to pretty much clarify things for us. It's all about facts, not fear. She's saying, I'm pregnant. If I get it, will my baby be okay? Am I more vulnerable? And you're saying that's not the case at this point.
Yeah, we don't know that at this point. Obviously, we ask for pregnant women to get flu shots and make sure they're getting all their vaccinations as required by their doctors, because that does keep you safe. Right now, there's not a lot of evidence that pregnant women are at an increased risk. However, just being pregnant in itself can increase your risk for some things. So we just ask that everyone's following doctor's advice. But I think we'll be safe, and your baby is going to be born nice and healthy.
Yes, Brooke, we're hoping that you have a happy and healthy pregnancy and that the baby's going to be just fine. We mentioned Lysol, and someone brought this over here. We have a
Yeah,
lot of this around the station.
yeah,
Lysol, hand sanitizer. Everyone's washing their hands more so than
sure.
usual. Keep on doing that, please, and
Yes,
thank you. You should be doing it anyway, as far as
yes,
I'm
you
concerned.
should.
Let me tell you, Chad, I was on the airplane this weekend, and folks around me sneezing and coughing. It wasn't the coronavirus. Normally, when I'm on the plane and doing that, I'm cringing like, that's gross, cover your mouth, that type of thing.
Right.
So, be precautious.
Yeah. Yeah.
So Caroline asking, what are the first symptoms?
Yeah, so it's going to be fever, cough, and sort of respiratory, that tickle in your throat, and just general malaise. So very similar to flu. We're not getting reports that people are sort of being knocked out like they are with flu. When you get the flu, you kind of know it. It's not quite that bad on the onset. But it's cough and respiratory. But I also like to remind people, it is technically still flu and cold season, and
Yeah.
the pollen count, as Mike and the weather team will tell you, is probably very high right now. So we don't want people confusing, seasonal allergies with the flu or COVID-19.
Yeah, which could so easily happen.
Yeah.
Rachel's wants to know, because I haven't heard anything about this. It's a good question, Rachel. How bad will it be for someone with high blood pressure? I haven't heard anything about folks with high blood pressure in this.
Yeah, there's not a real defined risk population that includes those with high blood pressure right now. I think that with anything else, some comorbidities will have some impact with viruses and things like that, but that's a little bit undefined right now. I'm sorry, I can't give you more information. We just don't know yet.
Yeah. Sokha Chan, she asked, pardon me if I'm pronouncing that incorrectly, it's Sokha. Last name is Chan. Why did she single out nail salons? That does bother a lot of people when you think about it. You don't want to hear folks singling out a certain population just because of this, because it's not right to do. But
Yeah.
as Chad mentioned, this could happen anywhere. It's airborne, right? It could happen in a
Yep.
grocery store, anywhere you go. So you just have to be
Yep.
cautious and smart. I'm coughing a lot. Started last night, Diane. You hear things like that, just like, ugh. Could it
Yeah.
could it be? You just don't know.
Yeah, yeah. Right now, we just say, if you're that sick, please see your doctor. And right now, we're really looking for people who have had risky travel to those areas that are having current outbreaks.
Yeah.
Right now, there's not evidence to show that, your cough is related to COVID-19 here in Jacksonville area.
Chad, Renee's asking how you feel about homemade sanitizer. We had Jessica Clark show folks how to make homemade sanitizer the other day. I tried it, felt the same as hand sanitizer. I don't know. How do you feel about it?
Yeah, I mean, we have to be careful with that kind of stuff because as consumers, the EPA, hospitals, the FDA, we put out things that are tested, that are trialed, that we know are effective in what they say they're going to do. Hand sanitizer really needs to be above 60% alcohol. And so if you don't know how it's being made, you don't know who's making it, I would just be careful with that.
Chad, I don't know that this is true. You can.
Sorry, Keith, I think I lost you.
You're back.
Sorry, I think I'm back.
Did you
Can you hear me?
Did you catch that one? I'm sorry, we froze up really quickly. Chris is asking, why are people with high blood pressure at a higher risk of a poor outcome if they contract the virus? We don't even know. Is that even true? Uh-oh, flipping him around a little bit. Okay. All right. So we are right now, we're going to get back to chat in a bit. But if you're just now joining us, so we have our first confirmed case of the coronavirus here on the First Coast. It's a 68-year-old man out in Nassau County. Late last night, the Florida Department of Health, they announced 8 new positive cases, including the one that we're all talking about right here on the First Coast. Right here on the First Coast out in Nassau County, definitely a concern. So the latest numbers at this point, we know that more than 1,000 confirmed cases in the U.S. and almost 30 deaths reported. Just like yourself, every morning I'm on my phone with new alerts popping up of new people who have contracted this virus. It is definitely a concern, and that's why we were talking to our expert this morning, Chad Nielsen, Director of Infection Prevention at UF Health Jacksonville. So we asked him about what our hospital systems are doing to prevent the spread. They say they do have systems in place. He was there through the Ebola, SARS,
Sorry
all
about that.
those
I think I've
crises
lost
that we
you guys.
had. And they are prepared to take care of it. So Chad is back right there. Chad, I want to get to this next question. We tried to ask this a couple of times. So let's get through it one more time with Krista. She's asking, and we don't even know if this is true. Why are people with high blood pressure at a higher risk of a poor outcome if they contract the virus? Is that true?
Yeah, so still undefined right now. I
Okay.
think there are some reported cases, but I think just in general comorbidities, people who have multiple, health conditions going on at any given time are going to have a harder time overcoming anything. So just follow your doctor's advice and you'll be okay. And I'm sorry, my feed's going in and out a little bit.
Okay, I'm going to ask you Rose Murphy's question. My daughter had to go to the ER yesterday. They said she has the flu. What do I look for if it is something else?
Yeah, so right now, the only risk for COVID-19 is going to be people who have had recent travel to those areas. So right now, if the doctors have diagnosed your daughter with flu, follow their advice. If you're continuing to not see, improvement after so many days, then that's when you want to go ahead and give the doctor a call again, and they'll start, doing more diagnosing.
Okay, Chad, we're going to wrap things up really quickly. Thank all of you who
Sure.
have been asking your questions throughout the morning. Chad Nielsen, Director of Infection Prevention of UF Health, we appreciate you joining us this morning.
Yeah, thanks for having me.
What should we all be conscious of?
Yeah, so just a few things that we keep saying over and over: hand washing, cough etiquette. Keeping away if you're sick, not sending your kids and employees to school sick, and then really, the last thing. It's a very movie thing, but stop touching your face. That's a very easy way to introduce things, and we do it without even noticing. So, this and that. Try and limit your exposure and clean your hands.
Yeah, you say that I quickly move my hand from face because, it's a bad habit for all of us.
I do it too, Keith.
Yeah. Chad, thank you so much for joining us. We appreciate it. Thank you guys all for joining in and chiming in the conversation. We appreciate you as well. Have a great day, a safe day. You just heard it from Chad there. The smartest thing to do, keep those hands clean. We're talking about washing as quickly, as often as possible. Also the hand sanitizer, and keep your hands out of your face. It's difficult, but it needs to be done. All right, folks, have a great day.